It's an ongoing crisis with no end in sight. I'm Lee Zurich.
And I'm Tisha Powell. Shortages of critical medication continue to rise. According to a 2023 report from the U.S. Senate Committee on Homeland Security and Governmental Affairs, between 2021 and 2022, drug shortages increased by almost 30%, reaching a 5-year high of 295 active shortages.
And this is not a new problem. The report details how more than 15 critical drug products have been in short supply for more than a decade. Experts say increased demand can cause shortages, but how drugs are made and sold in the country contributes significantly, and doctors say the consequences can be deadly.
Reporter Kristen Crowley introduces us to patients and practitioners navigating the supply challenges firsthand, and those tackling the issue head on.
You open up the cube.
9-year-old Josh Didier likes a good challenge.
Let me try to solve this.
He has fun putting puzzles together because they have solutions.
Come on, you got this, you got this.
But for months, one puzzle has been unsolvable for his Kansas City area family, and it's no game.
This seems like something that we could figure out.
Josh has ADHD.
Every other day I take one of these.
3 of his siblings have it too. His parents, Jeremy and Brian, say they know how to keep the disorder at bay.
Medication is the thing that helps them most.
But getting prescriptions filled, that's another thing.
We have our recipe for success and we can't get the ingredients.
More than a year into a nationwide ADHD medication shortage, Jeremy says making it all work hasn't been easy.
It's a full-time job. It's a lot.
Most recently, she says, she's had difficulty getting one of the medications Josh takes daily. She keeps hearing the same story from pharmacies.
It's back ordered and there is literally no date as to when it's going to be in stock.
And what happens if he doesn't take it?
Well, he gets pretty bouncy in class. He's making weird noises, he's throwing things at other students, he's kind of being singled out probably by other kids as like, okay, that kid is weird. What is going on over there? And it's heartbreaking.
ADHD affects more than 17 million children and adults in the United States. But the pharmaceutical shortage isn't limited to ADHD medication. In fact, hundreds of drugs have been impacted recently. Among them, children's medication, antibiotics, and cancer treatments.
Why are we seeing so many drug shortages?
We're near about a 10-year high, and most of the shortages that we see are due to some sort of quality or process issue with manufacturing.
Dr. Michael Gania with the American Society of Health System Pharmacists says cost is a driving factor.
In some of these generic medications, there may be actually manufacturers that are losing money on some of these products. So they'll eventually change their portfolio to things that are more profitable. And that makes the market less resilient and more prone to shortages.
The FDA declined to speak on camera, but said in a statement, the public should rest assured the FDA is working closely with numerous manufacturers and others in the supply chain to understand, mitigate, and prevent or reduce the impact of intermittent or reduced availability of certain products. But these shortages are nothing new.
The drug shortages have been a chronic plague for the last number of decades. They've become more frequent, more severe, and more unpredictable.
Dr. Andrew Schumann specializes in head and neck cancers at the University of Michigan Medical School.
So what happens when somebody who needs their cancer treatment can't get the medication they need?
It is an incredibly complicated problem and one that sometimes leads to tragic choices.
A 2020 study published in the British Medical Journal found that every month delayed in cancer treatment can raise the risk of death by around 10%. Schumann testified to Congress in March 2023, raising a red flag on that issue.
Sick Americans deserve access to life-saving medications.
It's one that Senator Gary Peters is working to address. He authorized a recent report on the health and national security risks of drug shortages.
And while some shortages may only be an inconvenience, others have had devastating impacts on patient care.
Working with other lawmakers, Peters introduced legislation in 2023 aiming to address vulnerabilities in the pharmaceutical supply chain and increase availability.
I thought, I want to be the change I want to see in the world.
Meanwhile, one mother in Florida has taken matters into her own hands.
There was no place to call for a patient or a family like me, and I found that very frustrating.
In 2019, using her business background and expertise, Laura Bray founded the nonprofit Angels for Change. She works with members of the supply chain, including drug makers, hospitals, and the FDA, to fill supply gaps, often tracking down extra medications or alerting manufacturers to increased demand.
People began to call, and then hospitals and physicians and pharmacists. And every single time we just tried to help. We said, I'll try. And each time I tried, I met new members of the supply chain who were willing to do extraordinary work with me.
It's a passion project born from personal adversity. Laura's daughter, Abby, was diagnosed with leukemia at just 9 years old.
They told us that the number one thing that we could do as parents was compliance of the protocol.
But the hospital didn't have the medication Abby so desperately needed. Laura called pharmacies, lawmakers, and pharmaceutical companies until she miraculously found an extra supply.
I know what happened to our family shouldn't exist. That is what drives me.
Today, Abby is cancer-free. And this chief changemaker has helped hundreds of thousands more, securing hundreds of treatments of more than 24 medicines on shortage. Hope amidst so much uncertainty.
It just seems like we're moving backwards.
The Didier family is trying to solve this problem the best they can, waiting for a solution they say is long overdue.
The fact that we cannot get that medication right now for all the people who absolutely need it is incredibly frustrating, and the fact that we have no answers as to why that is happening or a plan for that to be resolved, unbelievable. How does that happen in this world?
In late 2023, President Biden announced nearly 30 new actions aiming to strengthen supply chain resilience, including plans to convene a new White House council on the issue and to deploy the Defense Production Act, which would help U.S. manufacturers make more essential medicines right here at home.
As for what you can do, experts recommend patients have open conversations with their prescribers and pharmacists about any difficulties obtaining medication and available alternatives. Also mention any concerns about switching prescriptions.